Okay, thank you to our clerk. Thank you for everyone for adapting your schedule so quickly. Obviously, we've had some significant events and change of events in the last week with the advice of our medical officers of health in the GTHA. So as we begin today's meeting, we would like to acknowledge that we are gathering here today on the treaty territory of the Mississaugas of the Credit First Nation, before them the traditional territory of the Haudenosaunee, Huron, and Wendat. We also acknowledge the many First Nations, Métis, Inuit, and other global Indigenous people that now call Brampton their home. We're honored to live and enjoy this land together. Before we start today's meeting, I would like to ask that we pause for those that are, and remember those that are suffering from COVID-19, to reflect on our various frontline workers who are making incredible sacrifices to keep our community safe and functioning. On that note, good morning and welcome to this special meeting. The purpose of this meeting is to consider mandatory mask policy for the city of Brampton. Under council rules, no other businesses can be considered at this special meeting. And on that note, I kept everyone up to date that we had the meeting of the Greater Toronto Area Mayors, and we've been talking about this, the need to have a uniform policy throughout the GTHA, and the fact that all the medical officers of health were consistent in their viewpoint. And so we all agreed that we would take this to our councils as expeditiously as possible. As you know, the City of Toronto already ratified this just on Tuesday. I believe Mississauga is voting on this on Wednesday, and this will help public health. But I'd like to make sure that you hear directly from Dr. Lowe. I have the ability to be on a call with him every day, but I wanted council to hear why this is an important next step. So on that note, we'll begin the meeting with the city clerk calling the roll for attendance at today's meeting. Peter?
Members of council, I will call your names. Councillor Santos? Councillor Santos?
I'm here, sorry.
Thank you. Councillor Vicente?
Present.
Councillor Willens? Councillor Willens does not appear to be present. I'll come back to him. Councillor Paleshi?
Present.
Councillor Bowman?
Present.
Councillor Medeiros?
Present.
Councillor Williams?
I'm here.
Councillor Singh?
Present.
Councillor Dillon?
Here.
Mayor Brown is present. Councillor Willens? So, Mr. Mayor, we have 10 members present with Councillor Willens absent.
You forgot me, Peter.
Oh, I'm sorry, Councillor Fortini. I skipped over you. My apologies. Yes, you're here. Thank you.
Okay, thank you. We're now at item 2, approval of the agenda. We have a motion moved from, I need 2 councillors to move and second the motion. So we have a motion moved by Councillor Plessy, seconded by Councillor Singh to approve the agenda. Okay, Councillor Plessy.
Sorry, it's Councillor Dillon here. I wanted to add something to the agenda, a delegation.
Will this be at the point that we do that, Peter?
Yes, Mr. Mayor.
Okay.
So it's a delegation from Dr. Colvinder Gill.
So, Mr. Mayor, that would be proposed delegation if added 4.2 after the delegation from Dr. Lowe. And Mr. Mayor, I should also point out that there's 2 pieces of correspondence identified as 6.1 A and B, I believe it is, from Christine Massey, Brampton resident, and correspondence from Dr. Gill as well.
Okay. Instead of seeking a recorded vote, I will ask if there is anyone opposed to the motion. Otherwise, your vote will count in the affirmative. Is there anyone opposed to the agenda as amended?
So, Mr. Mayor, sorry, it's Peter. Your sound cut out there for a second. So I think I heard you saying Councillor Paleshi is the mover. I didn't hear a seconder for the motion to approve the agenda.
Councillor Singh.
Thank you.
Any objections? Hearing none, the motion is carried. Just to note that in-person attendance at this meeting is severely restricted to limit public gatherings and ensure physical distancing. Members and most staff are participating electronically. If you want to watch this, you can obviously watch this through our live stream, and we have a playback function on our videos archive system. If you want to ask questions, you can email the city clerk at cityclerksoffice@brampton.ca with your question, which will be read into the public meeting record during the 15-minute public question period before the end of the meeting. You can also continue to follow important service updates in regards to COVID-19 at brampton.ca. We're now at the point of item number 3, declarations of interest under the Municipal Conflict of Interest Act. Does any member have a declaration of pecuniary interest under the Municipal Conflict of Interest Act? Hearing none, the clerk will note for the meeting minutes. This takes us to delegations. And our first delegation is our medical officer health, Dr. Lawrence Lowe, who has been working his heart out for Peel Region to keep us safe. We're very fortunate to have a medical officer health that not only is a leading voice in public health, but worked on infectious diseases for the federal government before he was working with our local public health unit. So the fact that we've got someone who's an expert on infectious diseases is certainly handy during this time of health adversity. So on that note, Dr. Lawrence Lowe, if you could take council through why you made this recommendation for the mandatory use of masks in indoor public settings and how this will help protect the city of Brampton.
Thank you, Mr. Mayor, and good morning, councillors. Good morning to everyone. I'm happy to speak to the recommendation that I made last week that we consider moving towards a policy of requiring masking in indoor public spaces in the region of Peel and in the city of Brampton. It's important for me to state that in making this recommendation, the evidence around masking has not changed in recent months, although it has evolved since December when we first learned about the virus, COVID-19, initially. Throughout the course of this pandemic, the use of non-medical masks has always been recommended for source control. That message changed throughout the pandemic as we learned more about the pre-symptomatic nature by which this disease spreads. In February, advice around masking directed individuals to wear a mask if they felt sick, if they had symptoms, and also on a precautionary basis if they were in close contact caring for someone with COVID-19. When good evidence of pre-symptomatic spread started emerging from large studies in Europe during the crisis there, that was where our recommendation of masking moved to a more permissive recommendation, stating that individuals could generally wear a mask for the purposes of source control as they saw fit and as they saw able to. This was because it became clear and has become very clear since that COVID-19 spreads pre-symptomatically, that pre-symptomatic spread of COVID-19 is a significant contributor to transmission in the community, often occurring 48 to 72 hours before an individual actually starts showing symptoms. In this way, masks act as a form of source control. They essentially allow us to allow individuals to keep others safe in the event that they may be developing a COVID-19 infection, and therefore reduce the amount of respiratory droplets that they are expelling either through talking, breathing, or singing. Obviously, the permissive recommendation changed in May, as in March and April, you'll recall our focus was on trying to get individuals to stay home and to physically distance in order to reduce their interactions and reduce risk. But in May, as we reopened in stage 1 and now subsequently into stage 2 of Ontario's reopening, it became very clear that with pre-symptomatic transmission and increasing people out and about in our community, there was a greater need for us to ensure that there was an additional line of defense to physical distancing, especially where it may not be possible in tight quarters, in buses, etc. etc. And so it's for that reason that the recommendation changed from a permissive recommendation into a strong recommendation in May and June. This was based on the evidence, as I've said, of pre-symptomatic transmission and our understanding of the role of masking in respect of source control. With Peel Region's move to stage 2 on June 24th, it's increasingly evident now that there are many interactions that have started up in our community. And you've heard me say before, Mr. Mayor and Council, that when you open things in a region like Peel, it's very different from opening things elsewhere in other communities. There are many more people here. There are many more opportunities to interact. There are many more potential instances where transmission may occur. And so it is for this reason that last week I issued my recommendation that we move from strongly recommending masks, which has always stayed a strong recommendation since early May, to consider mandatory masking or a masking requirement in specific indoor public places. The reason for this was threefold. First of all, we are very much in the tail wave of the first pandemic, but we are still pushing towards a goal of seeing 0 new daily cases here in the region of Peel. Ideally, having more people wearing masks as a purpose of source control will allow us to continue to identify individuals through testing and tracing, but ensuring that the people who are pre-symptomatic and who are not yet detected by that mechanism are not transmitting the disease in the first instance. Second of all, having mandatory masking or a universal masking policy in certain public places reduces the risk of transmission to employees and to other individuals who may be in that space, particularly individuals who are vulnerable and who are unable to wear a mask for whatever reason. And so certainly any bylaw or any recommendation will take into account certain exemptions for individuals on the basis of age, on medical conditions, and it therefore becomes more incumbent for everyone to be able to medically mask, to use a non-medical mask in helping to keep those populations safe. Thirdly, the reason for this recommendation is to bring consistent clarity to what was already a strong recommendation. We had been asked by businesses for this clarity. We had been asked for members of the community for this clarity, because a strong recommendation is, well, we strongly recommend it. But when you move to a requirement, it became, in certain settings, as I understand it, it becomes a clear piece from a business perspective where a business now is licensed to say, you have to, you can't, as opposed to, well, it's recommended, and so our policy is such, but then it becomes a bit more challenging. So for the sake of consistency of message and expectations, for the purposes of controlling disease spread, because we do have very good evidence that this disease promotes pre-symptomatically, and for ensuring that we protect populations that are already vulnerable and that for many reasons may not be able to wear a non-medical mask, I issued this recommendation to move to a masking requirement in certain public places. It's also worth noting that this recommendation would bring us into consistency with many other jurisdictions, including the City of Toronto, Wellington, Dufferin, Guelph, and also York Region, that all border us, that are contemplating and moving towards this measure. And it is a matter of then ensuring that our residents are clear as to the reason why we are all aligned and making sure that we are all aligned so that there isn't confusion in the public. So it's for this reason, members of council, Mr. Mayor, that I have brought forward my recommendation. I think it is going to be it's going to be one part of the overall suite of recommendations, and it's important for me to reiterate here that we mustn't forget the rest of the core 4 behaviors around physical distancing, getting tested and staying home if one is sick, washing one's hands frequently. But we have long recommended, on the basis of evidence that has not evolved too much in the last 2 months, the use of non-medical masks in certain public settings where distancing is difficult. And this is, for many reasons, as I've outlined, the next step in terms of pushing us into the final, and pushing us to the end of the first wave, keeping those that are vulnerable in our community safe, and ensuring that there is a consistent application of this measure, together with the rest of the measures that have been identified throughout our community, and bringing that sort of clarity to our businesses who can now move forward as they've requested on this. So with that, Mr. Mayor, I will stop there and be happy to answer any questions you may have.
Okay, members of council who have questions for Dr. Lowe, I will make a list, and maybe I can start with the first question. Dr. Lowe, I know there's been a lot of research on the use of mandatory masks. I was reading some of the research from Cambridge University on their study, the IZA study in Germany with the city of Jena, the recent US study. Is the medical data, the scientific research pretty conclusive when it comes to the mandatory masks helping diminish the spread?
Thank you, Mr. Mayor, for the question. The data continues to evolve. The evidence obviously is not necessarily fully definitive at this time, but it does. There is clear indications that is the direction that we are seeing in many settings where masks have been widely taken up. There has been a reduction in transmission, and there has also been a reduction of severe outcomes, particularly amongst vulnerable groups. Now, again, because this is such a new disease, incontrovertible evidence is still being developed and still being studied. But it is very clear, at least on the basis of what has been seen in other jurisdictions that have seen significant mask uptake with or without a mandate, that there has been overall optimistic results in respect of spread when it is coupled with the rest of the measures that I have identified in terms of distancing, hand washing, and staying home when sick and getting vaccinated.
Dr. Lowe, the first question is from Councillor Williams.
Hi, thank you. Through you, Mayor. Dr. Lowe, thank you so much for your recommendation and your input on this topic. There's definitely been a lot of feedback from the community requesting mandatory masks. And but there's also been some confusion and question around what type of masks to use. Some members of the community have shared that R95 masks, which were widely recommended, especially the ones that have the venting, they actually don't filter air coming out of the mask. So if a person is sick, then their exhale can actually transmit the virus. So people are wondering if, when it comes to face covering, which one would be the best, the safest, and the most effective one for them to use?
So thank you, Councillor Williams, for the question, and through you, Mr. Mayor. At this time, actually, in respect of non-medical masks, really the identification is any sort of non-medical mask or face covering will provide some benefit around source control. Now, certainly what you're describing with the specific mask that you've identified, it may be a case of a specific threshold that people were identifying in terms of the number of particulates, but I think it stands to reason that having any sort of barrier in front of your face is going to reduce the number of respiratory droplets and particulates that are expelled. And so I think the clearest evidence is that it needs to be some sort of non-medical mask, ideally cloth. If you're able to, basically cloth masks are sort of the focus, or have been the focus in many of the studies and the data that we've been looking at. But I think the more important thing is actually that it be worn properly. And so it's less about, I would say, the material, but more about the physical barrier, ensuring that there is a covering of the eye, of the ears, and not the ears, pardon me, the nose and the mouth, and making sure that those are covered to ensure that respiratory droplets, to a certain proportion, are actually covered off. So it is really that sort of mechanism around a physical barrier, ideally. And less about the type of mask or the material that's in question. I hope that answers the question. Thank you.
Yes, thank you, Dr. Lowe. Through the Mayor, just to follow up, I think it's very important that all of us are taking precautions, and I just wondering if you could share a message around the importance of our understanding that we are going to mandatory masks. However, if it doesn't mean that COVID doesn't exist anymore. We are still in a pandemic, and hand washing and ensuring if you can stay home and social distance, that is the best way to go. So thank you so much.
Thank you, Councillor Williams. Councillor Paleski.
Thank you, Mr. Mayor. Dr. Lowe, thanks so much for the delegation. Dr. Lowe, can I just confirm that anybody that's been infected by the virus Um, and they've been advised to wear medical masks, not just non-medical masks, but they're actually being advised to wear medical masks.
So thank you, Councillor Palashi, and through you, Mr. Mayor. I believe individuals who are, so I believe this is an older recommendation, but it is the idea that if an individual is COVID positive and has symptoms, ideally they should be staying home. And in respect of staying home, they should be so physically distancing as much as possible from other members of the household, failing which they should ideally be wearing masks. And ideally, as I understand it, it would be a medical mask. I have to double check, and I can undertake to double check and confirm the exact guidance on that around self-isolation. But I believe the recommendation is ideally medical masks. But again, if not, then literally any other face covering, if social distancing can't be maintained at home, is recommended for individuals who are symptomatic with COVID.
For sure, and I think you agree, and I think that the World Health Organization also agrees to the fact that masks are not just the one-stop shop. They're not the everything or the only thing that you need to do. There are a number of things that we all need to do, and if you're COVID positive, then yes, staying at home, self-isolation is that number one. But then if things need to happen and people are wearing, and I know that World Health Organization also recommends that if you are COVID positive, that you are using a medical mask as well. So no need to confirm. I think I'm satisfied with that, and just knowing that that's not the only thing that we should be doing. There's a number of things that we need to do to stop this. Thank you, Dr. Lowe.
Thank you, Councillor Palashi. The next up is Councillor Singh.
Hi, Dr. Lowe, thank you for taking the time out to present. I know you have your hands full during this time. My first question is there any drawbacks for masks for seniors or people with asthma or anything?
So thank you, Councillor Singh, for the question. Through you, Mr. Mayor. Yes, there are certain individuals for whom wearing a mask can be difficult by virtue of a medical condition, and so certainly there would be. I mean, my recommendation includes the suggestion that those individuals be exempt from any sort of requirement, but typically these would be individuals who may have underlying respiratory conditions, and also individuals who may have anxiety disorders or other sort of disorders, feelings of claustrophobia. Those are some individuals who certainly I imagine would not be covered by a requirement, and certainly would not have been covered by the previous strong recommendation that we had issued previously as well.
Okay, all right. And I had one more question, and it's just, yeah. And what about for indoor physical activity, in the sense obviously we're not going to recommend for pools right now. Our indoor pools are open, I believe, and I imagine we might have other openings around physical exercise. So I'm assuming your recommendation also amidst people engaging in physical exercise.
So thank you, Councillor Singh, through you, Mr. Mayor. If I may, in fact, the recommendation is that this be a temporary regional bylaw for the time being. As I understand it, gyms, etc., will be open in stage 3, and I presume that by the time we get to stage 3, there may not necessarily be a need for this bylaw to continue, hoping that the pandemic picture will have evolved by then. So thank you.
And that's kind of in line with our neighboring municipalities, that mindset? Okay, perfect. Thank you.
Thank you, Councillor Singh. Are there any other councillor questions? I don't see any other councillor questions, so we will thank you, Dr. Lowe. And Dr. Lowe, if you could stay on, there may be some additional questions for you after the delegation. I think we have a delegation that is calling into question some of the advice of public health. So I think in fairness, if you were on the call to answer any of that interpretation, would be helpful. And we know We know you have to be at the public health table at 10 o'clock for Ontario, so we will be mindful of that. So we have a motion moved by Councillor Williams, seconded by Councillor Santos, to receive the delegation from Dr. Lawrence Lowe, the Medical Officer of Health, the Region Appeal, in regards to mandatory mask policy. This is just to receive the delegation. Are there any objections? Hearing none, the motion passes to receive the delegation. Now, to our clerk, is now the time we have the delegation from Dr. Clavinder Gill?
Mr. Mayor, yes, that's correct.
Okay.
So, Dr. Gill,
Have you arranged?
You can go ahead. You're in the session, and you can turn your mic on. Thank you.
Can everyone hear me?
We can. And so, Dr. Gill, just to let you know, for public delegations, we have 5 minutes. So we'll start your time now.
Okay, can I kindly request a short extension?
I think we're going to have to stick to the 5 minutes because we do want to have Dr. Lowe available, and he has to go to the provincial health table today.
Can I request 7 minutes?
I'll move 2 extra minutes. Yeah, Councillor Dillon here.
Okay. Is there someone else on council that will support that?
Happy to support, Mayor.
Okay, I see 3 still supported. More? Just put in the chat box if there's more than 3.
Saying will support too. It's just 2 extra minutes, 7 minutes. And you can time it as well, Mayor.
Okay. Okay, there's 4. I'm just going to assume that there's a 5th. So starting now, you have 7 minutes, Dr. Gill.
Good morning. Thank you for the opportunity to delegate to Council, Mr. Mayor. I had provided a written submission which will go into more detail than I'll have an opportunity to go through on the call today. I wanted to write, I had initially written to express some concerns that I had about the mandatory masking policy. And as you're aware, I'm a frontline physician practicing here in Brampton and a longtime advocate for the citizens of Brampton, our province, and our country to access quality and timely health care. Just a bit about me, my undergraduate training was in microbiology, my postgraduate training was in immunology, and my medical research was in virology at the Public Health Agency of Canada's only level 4 National Microbiology Lab, focusing on HIV-1 vaccine development. My concerns center around the lack of published scientific evidence to support the use of cloth masks for actually reducing the transmission of the SARS-CoV-2 virus, which leads to COVID-19 disease. And based on the statements that had been made by Mr. Mayor and by the PO Public Health Interim Officer at the press conference, indicating that that this was based on people, quote, believing that it's the right thing to do, end quote, and that the, quote, residents were asking for it, end quote, and that public health was doing, quote, public surveys, end quote. It seems to be much more politically driven than it is scientifically driven. The World Health Organization advises against the mandatory masks for public. On June the 5th, the World Health Organization published advice on the use of masks in the context of COVID-19, indicating that there's no direct evidence from studies on COVID-19 in healthy people in the community on the effectiveness on universal masking of healthy people in the community to prevent infection with respiratory viruses, including COVID-19. It further went on to state that there were potential risks and harms associated with this approach, you can find a detailed list of the potential harms in the written submission. The Government of Canada's Public Health Agency also does not recommend mandatory masks for the general public. The Public Health Agency has expressed concerns regarding the limitation of cloth masks. Quote, homemade masks are not medical masks and are not regulated like the medical masks or the respirators. They have not been tested to recognize standards, and the fabrics are not the same as those used within the surgical masks. the Public Health Agency of Canada, which you will find in the written submission, goes further into expressing significant concerns about the use of such masks and the false sense of security that it often provides the wearer. Similarly, Dr. Anthony Fauci from the Center for Disease Control in the US had said that when you're in the middle of an outbreak, wearing a mask might make people a little bit better. It might block a droplet, but it is not providing the protection that people think it is. And it often there is unintended consequences where people are fiddling with the mask and they're touching their face. When you think about masks, you should think about healthcare providers needing them and people who are ill. End quote. Dr. Chris Mackey, the medical officer of health and the CEO for Middlesex London Health Unit here in Ontario, echoed this sentiment this past week, where he said that so you make them feel safe by wearing low-grade masks that don't make any difference. That may be popular, but it's not good public health policy, end quote. On June the 24th, the Annuals of Internal Medicine published an extensive review, systemic review, and a meta-analysis which concluded that evidence on mass effectiveness for a respiratory infection prevention is strong in the healthcare setting, but not in the community setting. Similarly, on June the 27th, the Lancet published an extensive systemic review and a meta-analysis of 172 observational studies across 60 countries and 6 continents. And they concluded that there was, quote, low certainty, end quote, for face coverings worn by members of the public. Peel Public Health's own sampling study in May found that 87% of the cases here in Peel are within the healthcare setting, 82% are associated with outbreaks in the healthcare setting, and of the remainder, 23% were in non-healthcare settings, such as correctional facilities. The original intent of the lockdown was to prevent overwhelming of our healthcare system resources, but the goalposts continue to change, and we have neglected the non-COVID-19 patients and the significant amount of harm that we have caused them. There have been strong indications, which are provided in much more detail in the written submission, that the virus now is not the same virus that we were dealing with in January or even out in April. Virologists have published a study just a few days ago, which has shown that there's a significant reduction in the viral load, and researchers in Thailand and the US have also found significant mutations which were similar to the ones that mirrored the SARS epidemic in 2003 that actually slowed down that virus. And we're not taking into context the existing, pre-existing cross-protective immunity that we do have from our previous exposure to common cold coronaviruses. We're not taking into account the host versus a virus immunology that plays out, and there's been a lot of fear mongering through the media, which I think is feeding into a lot of this decision making, which seems to be reactive to public pressure, which is bad public health policy, as opposed to looking at the solid evidence that we have and the indications that there's now far fewer hospitalizations and ICU admissions than we used to have, because the nature of the virus is actually changing. And I find it deeply concerning that this is becoming a politicized. So I would strongly recommend sticking with masks being strongly recommended to ensure that we protect public trust within public health policy, and that we're able to move forward to encourage the existing public health measures that we know have strong impact, as well as implementing other public health measures which we can implement in terms of surveillance to help us ensure that we have a safe reopening.
Okay, thank you, Dr. Gill. That is your 7 minutes. Are there any questions? Okay, thank you, Dr. Gill. There's no questions. Thank you for your time today.
Thank you. If I could kindly request that the council does have a review of the entire submission. There are further details there, including the disproportionate impact that the fines will have on the marginalized communities, which are significantly represented here in Peel, specifically the Black and the South Asian communities, which were the communities that were disproportionately impacted by the previous fines that were placed on parking lots and in parks, and the lack of enforcement that is planned, then is there really a need to make something mandated if it's not planned to actually enforce it?
Dr. Gill, we did extend your presentation by 2 minutes, but thank you for the additional comment. Thank you for joining us today.
Thank you so much.
So, Mr. Mayor, there would be we need a motion to receive the delegation. We need a mover and seconder, please.
Okay, so I guess Councillor Gurpreet Dillon was the one that put this forward.
Yeah, I'll second it. Yeah.
And Councillor Singh. Councillor Peleshy wants to make a comment before we vote on this. Councillor Peleshy?
I thought there was going to be more comments or more questions, but I'll just make the brief comment of, I respect Dr. Gill. Every time she's been before us, we've always supported what she does and what her delegations have been about. I think that I got to say I'm a little bit disappointed with this delegation. I think that if it was politically driven, I think that we would have closed our borders a lot sooner. We would have established faster testing sites, and we would have been more prepared on this. But that's just me stating from way back when that I thought that was the route that we needed to go back then. I think it's very difficult, if anybody's been to a grocery store, to keep that distancing apart from one another. I often find myself going up aisles and having to cross paths within inches of people and people behind me and not giving me that out. I think World Health Organization has recommended the use of masks. They encourage the use of masks, but it is important to note that they have said that masks should be used as part of a comprehensive strategy. Masks on their own will not protect you from COVID-19, and people should always clean their hands frequently. They've also stated that government should encourage the use of non-medical masks, which can act as a barrier to prevent the spread of the virus from the wearer. I noticed during this whole thing that there's a lot of I use this term lightly, he said, she said, where it's kind of back and forth. For any evidence that comes forward, you can find something else. I've stated before that we didn't learn as fast or move as fast as we should have when we saw this pandemic going through China, Italy, Iran, Spain, France. And I'll state again where we think we're starting to lighten up some of the restrictions, and we see where there's New Zealand, where they announced that they eradicated the virus, and they let 2 people in from England that had the virus. Those 2 people saw a bunch of people, and now I think the virus is up to as of today 1,150. I think we all know what needs to be done, and this is a good step in the right direction, knowing that masks are not the only thing that we should be doing. Like Dr. Lowe said in my earlier comment, this is just one of many preventative measures that we need to do to ensure the safety of the residents. Thank you, Mr. Mayor.
Thank you, Councillor Peleshy. So, Councillor Santos, you no longer have a comment? Any objections to receiving this delegation? Hearing none, the delegation is received. And in fairness, since Dr. Lowe was mentioned, before I move to the resolution, let's just give Dr. Lowe chance to respond. Dr. Lowe, are you still on the call?
Oh, thank you, Mr. Mayor. And yes, if thank you for the opportunity to respond. Certainly glad to hear from Dr. Gill and very much appreciate. If anything, I would say it's important at this point in time, and as I've indicated, it's important to avoid drawing any specific conclusions one way or the other. And I think I wanted to make very clear that I have read many of the similar studies that Dr. Gill has identified and many other reviews by the same agencies. We know that the evidence base continues to evolve, and it's very important for me to say that my recommendation is certainly not based on politics, but is based certainly on the suggestion that the evolving evidence base is starting to point towards a direction where increasing non-medical mask uptake is essential to preventing pre-symptomatic transmission in our community. And I did want to clarify one thing that Dr. Gill had mentioned, around 87% of cases in Peel having been healthcare workers. That was actually a journalistic error. They used the information that we had on occupations, which was a study of about 800 cases that we had. But it's not that 87% of all of our cases in Peel have been healthcare workers. And so I wanted to clarify that as well. Certainly just wanted to make sure that we're right on that piece. But I think the fact that Dr. Gill agrees with the idea that masks should be, whether she agrees that the masks should continue to be strongly recommended, I couldn't agree more on the basis of evidence, at least in terms of where things are going. And like I said, I think the move to a mandate is to ensure that we're being consistent in messaging and ensuring that that strong recommendation on the basis of evolving evidence is taken up. So thank you, Mr. Mayor, for the opportunity to respond.
Thank you, Dr. Lowe. And just one thing we should add, I think that's noteworthy is you've been talking with Toronto's medical officer of health, and there's a high level of coordination between all our medical officers of health. Is that fair to say?
Thank you, Mr. Mayor. Yes, there's certainly a high level coordination between medical officers of health and also with provincial and federal agencies, and it is clear, at least our reading of the evidence is moving towards trying to make this requirement an opportunity to bring this up. But certainly, as I said, based on what I hear from Dr. Gill, we're quite at least aligned on the idea that this is a strong recommendation, and I think the move to a requirement is meant to make that absolutely clear.
Okay. Thank you, Dr. Lowe. I see that Councillor Dillon has a question. Peter Fay, procedurally, can I continue with questions because this is a response?
Through you, Mr. Mayor, if you've invited Dr. Lowe to respond and members wish to speak and part of their comments are a question to Dr. Lowe, that is appropriate. Dr. Lowe was invited as a guest to present at this meeting. Perfect.
Okay, Councillor Dillon.
So I just want to thank Dr. Gill for delegating. She had contacted me yesterday and she gave her, I guess you would say, opposing viewpoint of the recommendation today. And I just want to make a comment. I don't think, I've had a chance to speak to many of our councillors here, and everybody's taken this issue extremely seriously. And I don't think it's a political decision. I just want to make that clear. And so, everybody, we've seen the suffering. We've seen, a lot of people get infected from the Brampton area. And so I think council is making the best decision it can make with the information it has, and hopefully we'll be able to decrease these numbers going forward. And we're all looking forward to see when this virus is gone. And so I just wanted to make a quick comment, but I want to thank Dr. Gill for coming today. Thank you.
Okay, thank you, Councillor Dillon. So this takes us to the next item, which is item 5.1, to consider a motion for mandatory masks. And we have the motion on the screen. This would enable Diana. Diana drafted this motion. It would enable for her to come back with us with a bylaw for next Wednesday. So this motion is similar to the one passed in Toronto to initiate the process. And then next Wednesday, we could approve an actual bylaw that would include whether there's going to be fines or whether, what the scale of those fines would be, the grace period. Those would all be things that can be considered next week. But are there questions on this motion? Okay, I'm just looking at my thing here. I have Fletchy.
Thank you, Mr. Mayor. Whoever's typing, can they mute themselves? The communication that's going to be going out with this, I just wanted to ask that it will reflect, what we've heard today, where masks are not that one-stop shop. That there are a number of things that need to be done to combat this this virus, and that will be in the communication. Can I just get a response by communications if they're on?
Hi, Councillor. It's Jason, and through the chair, we'll make sure that any communication reflects public health's core 4, which a number of steps that individuals should be taking, as well as masks to ensure public safety. So we'll ensure that all 4 of those are reflected in the communication. Thanks.
Okay, thank you. And I've recently spoke to a couple business owners that have started implementing this in their business already, asking people. They're not directly asking people to wear masks. They're still a little bit on the fence and uncomfortable about forcing them that on their customers. But where I've never seen them wear masks before, they've started themselves wearing masks. So I think that we have to be clear in what that grace period and timeline should be as well.
Would that be for comms or for, do you mean for bylaw or?
Well, it'd be with the two of you, comms and bylaw, just when we again get this out to ensure that what business owners are going to be responsible for when we pass this, what the grace period is, and maybe some suggested avenues on how they can discuss or what they can post up in their business to ensure that all their customers fully understand the bylaw.
Sure, and we'll make sure that there's clarity for, through the chair, that there's clarity for individuals as well as businesses. And I know, and we can point people to some of public health's content. They have a series of posters available for businesses that provide the clarity from public health that they can post in their businesses on a whole range of steps that they can take.
Okay, thank you, Jason. Thank you, Mr. Mayor. I'm happy to second this motion.
Thank you, Councillor Paleshi. I've had a few councillors, Councillor Williams, Councillor Santos, all ask about seconding. Do we want to say seconded by all of council? Is there anyone against that? Anyone in council that does not want to second this? Okay, hearing none, so it'll be all members of council. And thank you, Councillor Paleshi, for being an enthusiastic supporter of this early on. I just want to note your particular support for this. Not to diminish you seconding it, but I think this is something everyone wants to rally behind. Okay, we have the motion on the floor, and we have a recorded vote request.
Recorded vote has been requested. All in favor, please indicate. Councillor Santos?
Yes.
Councillor Vicente?
Yes.
Councillor Willens is not present. Councillor Paleshi?
Yes.
Councillor Bowman?
Yes.
Councillor Medeiros?
Yes.
Councillor Williams?
Yes.
Councillor Fortini?
Yes.
Councillor Singh?
Yes.
Councillor Dillon?
Yes.
Mayor Brown?
Yes.
Mr. Mayor, that motion carries unanimously 10 to 0 with 1 absence.
Okay. This takes us to correspondence. We've already noted the correspondence, correct, Peter?
Mr. Mayor, no, we should receive the correspondence, which is identified as, I believe, 6.1 and 6.2.
Okay, by Councillor Dillon and Singh. Are there any objections? Hearing none, the correspondence carries. Public question period. Are there any public questions to our clerk?
Through you, Mr. Mayor, no questions have been received at the city clerk's inbox.
Okay, this takes us to confirming bylaw. Our next item is item 9.1. The confirming.
Can I ask a question, Mr. Mayor?
This is to the clerk.
Yes, through the clerk.
Sorry,
Peter?
is that Dr. Gill? Dr. Gill is entitled to ask a question during question period, yes.
Okay.
Go ahead, Dr. Gill.
Oh, thank you. What legal liability would be placed on businesses forced to comply if a member of the public has an adverse health event as a result?
Is Diana Seuss on the call? If she wants to answer that.
Yes, thank you, Mayor Brown. And through the chair, I can't provide legal advice in relation to matters of the nature that has been requested by Dr. Gill. Legal advice can be provided by city legal counsel in relation to city liability and matters. And typically that would be done in closed session. And it would be my recommendation that any advice of that nature be received by counsel in closed session.
My question doesn't pertain to city council's liability, but individual businesses' liability, because in how the city of Toronto worded their motion, it forces businesses within the city of Toronto, which I suspect this motion will as well have similar wording, where it forces businesses within the city of Brampton to comply and to ensure that not only their staff, but that their patrons are actually wearing masks. So if a member of the public has an adverse health event at that establishment or at that business, or as a result of wearing a mask at that establishment or at that business, what legal liability would be placed on that business? Because if an establishment is being forced to do something by the city and the existing scientific evidence does not support it, then that places an individual business in a legal liability situation.
Okay, I think
All right.
I think Councillor Palashi wanted to answer that, and thank you for your question, Dr. Gill.
Thank you, Mr. Mayor. I would just ask it's a really good question, and I think that's maybe there's an opportunity for legal to take a step back and come back when we ratify this, when this goes to council next week for ratification, if legal can provide a response.
Through the chair, I would be more than happy to, and in fact, I expect that there will be a corresponding legal report, complementary legal report that will proceed with an open session report next week to council on this matter, and we can certainly provide some further insight there. But perhaps I can provide some assistance in this respect now. Similar to my response when the question was asked with respect to face masks on public transit, in my view, this is an additional element of due diligence that is being put forward, in this case, mandated by the city, but would be implemented by businesses, and in my view, would not afford additional liability to businesses, but would in fact assist them in establishing that they've met their due diligence requirements.
Okay, thank you, Diana. This takes us to our confirming bylaw. The confirming bylaw, I have a motion moved by Councillor Vicente, seconded by Councillor Fertini to approve the confirming bylaw to confirm the proceedings and decisions from this meeting. Is there anyone opposed to the confirming bylaw? Hearing none, the motion carries. This takes us to adjournment. Council is next scheduled to meet Wednesday, July 8th at 1 p.m. I have a motion from Councillor Medeiros and Bowman to adjourn today's meeting. Is that okay? I'm assuming Councillor Medeiros and Bowman are okay being the mover and seconder there. Is anyone opposed to the adjournment until next Wednesday? Hearing none, the motion carries. The meeting is adjourned. Stay safe, stay healthy, and most importantly, please practice physical distancing and please wear a mask when in enclosed public spaces. Thank you, everyone, for accommodating this meeting. Obviously, this was an important discussion that we wanted to have council's buy-in immediately, and grateful for everyone adjusting their schedule.